Dr. Rob, so many of your patients have commented on how impressed they are by your new patient exam. They find it refreshing that you get to know them, you do a thorough dental exam, and you also set expectations for their dental health. Now, what would you say is unique about your first patient visit? And what would you say to a first patient as to what they can expect on that first time they meet with you?
So I think there are a few things that are unique about my examination. The first thing is that I do spend quite a few minutes just talking to a person and finding out who they are and what their past experiences has been like, their health history, things like that. But also finding out what their goals are is one of the cornerstones of a good dental examination. Another thing that is unique about my dental exam is that um, I do a full systems evaluation. So instead of just looking at your mouth as one tooth at a time, I look at it as an entire big picture because everything is interrelated. So my exam is designed to do two things. One is to give people a really good idea about how healthy they are. And the second is once we're done with the exam, there's going to be three critical areas that I'm going to assign some risk factors. And my goal is to help people keep their teeth for their lifetime. So I like to help them get healthy, but then over time reduce these risks down as close to zero as possible so people get to keep their teeth. Now, as far as what they can expect during their new patient exam, after we're finished in my office talking, we'll go back into the operatory and I'll start doing my examination. And the first thing we do is an oral cancer screening. We're looking for any lumps or bumps or oddities that might be potentially dangerous. Then I'm going to look at their teeth and their dental restorations carefully to make sure that they're healthy. And then after that, we'll examine their gums and the bone that supports their teeth. And the last thing I'll look for is the chewing system, how the teeth, the muscles, and the joints all work together mechanically. And like any other mechanical system, if things are in harmony, they last a long time without wearing themselves out. But if things are not in good alignment, things will wear out early and prematurely. Mm-hmm. After I'm done with that, I'll spend a few minutes just kind of reviewing everything that we found today. And then we'll take some necessary x-rays. And after the x-rays are taken, the visit's done. If a person's problems are complex, they'll come back for another visit where where the patient and I will then sit and together come up with a plan that makes sense for them, both a short-term plan to manage acute disease, maybe gum disease or tooth decay, maybe a broken tooth, whatever that happens to be, but then the long-term goals also. Frequently people have long-term goals, but the first thing we always want to make sure of is that they're healthy first before we then move ahead and start building maybe a beautiful smile or stabilizing their bite. So if their problems are not complex, then I'll probably just sit down with them for a few minutes and talk to them about the few problems that they have, the things that we can do to fix those problems. And it's important to me that my patients and I create a partnership because there's a lot of different ways to do things. And I want people to feel comfortable that they have a role in how their plans play out. So at that point, we might finish up with just a simple plan, and the next visit would typically be a cleaning.
It's wonderful. Well, thank you for taking the time to explain the new patient visit. I think it's really interesting for those who are considering your practice.
Thank you, Kara.